Hi, I'm Dr. Barrett from Mayo Clinic in Florida. Mr. Smith, how are you today?
I'm doing better.
Good.
My right side's a little weak this morning when I woke
I
up.
see. Okay. What time did you get up today?
About 9:30.
Mm-hmm.
And I can't really move my arm earlier, but my leg I can move it. It's just a little weaker than what it was.
I see. All right. And how did you get to the hospital here today?
My friend drove me over from home.
Good. Do you have any other medical problems, sir?
No, not that I'm aware of, I think.
Okay, good. What I thought we'd do is, because our concern here is that of stroke, is we go through a brief neurologic examination, and then I'll be able to review some of your films, and then we can make a decision about whether or not a clot-busting medication like TPA would be appropriate to treat the stroke.
Okay.
All right?
All right.
Now what I'm asking you to do is take your right arm, hold it straight out in front of you, up to Katie's hands for a count of 10, okay?
Okay.
Hold it up there. Maybe Katie, you can help him get it up there, and then we'll see how much it drifts down. So it kind of falls right away, huh? All right, why don't we try the left arm? Hold it up to Katie's hand just for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. And what I'd like you to do, maybe Katie, we can just take down the cover so we can see his legs. And let's start with the left leg. Just raise it straight off the bed about 30 degrees up to her hands for a count of 5. 1, 2, 3, 4, 5. Good. Let's see the right leg if you can. You may have to help him up there. Okay, try and hold it up there for a count of 5. 1, 2, 3, 4, 5. Perfect. Okay, Mr. Smith, I'm going to show you a few things here on the screen. What is this?
It's a glove.
Perfect.
A key. The cactus. It's a chair. A feather. It's a hammock.
Say this as clearly as you can.
Mama. Tip top. 50-50. Thanks.
And is there a pen light in there or any kind of flashlight?
Yes.
Why don't we just have him look straight out towards the screen, and let's just see if we can appreciate a pupillary light response.
Okay, look straight ahead.
And light's kind of high, but
Ready?
yeah.
It's kind of not real bright.
It's okay.
All right, well, Mr. Smith, what we're going to do now is we'll review your CAT scan, but otherwise I think, Katie, you should start pulling up the TPA. It's a 0.9 milligrams per kilogram dose, and I think he'd be a good candidate to be treated for this ischemic stroke.
Okay.
Okay?
Thank
All right,
Sounds good.
good.
Thank you.
No problem. All right, bye. The need really, this serves a couple purposes. The ability to not only treat more patients with TPA for ischemic stroke that are outside of our community and may not have access to neurologists, but also it's a way to identify patients that may benefit most from being transferred to us. Because often we're called with patients who may potentially need to be transferred, but if we can see them and evaluate them first with a device like this, then we don't have to expend energy, resources on patients who come here and nothing different is done. So it's a way to triage those patients who would benefit most from urgent transfer. For the relationship that we have at Parish Medical Center, we actually, the business model is a subscription. So we don't bill individual patients, rather Parish pays Mayo Clinic a set monthly fee, and that essentially is the retainer for access to us 24/7. So we don't bill individual patients, we're just paid a monthly subscription fee, and that gives them access to our. Yes, that's one of the big administrative burdens of this is we all had to be fully credentialed at Parish Medical Center, and that's within the state of Florida. But as soon as you start crossing state lines, you do have to have the other state's license. So we've been licensed, the 4 of us in Georgia, anticipating doing this at Waycross at the Mayo Clinic Health System. So licensure and both at the local institution and state licensure is one of the sort of administrative barriers you have to overcome to do this widely. The most rewarding is really any of those patients that we're able to treat with TPA. So for instance at Parish, those patients otherwise, because the time window is so short, and if you have to transfer a patient like that and you can't treat them locally, then often you're going to burn up the time in transit. So all of those patients that we've treated at Parish, and we've done almost 40 patients with TPA there over about 2.5 years, and the patients that end up being transferred here as well that we help with catheter-based treatments, or all of that's very rewarding. The licensure, etc. There's the whole educational component, so getting nursing used to interacting with somebody remotely, how to not stand right in front of the camera when you're examining somebody and be off to the side.
That's right.
So the educational aspects of it, and then also the technical aspects of being able to, use the camera, zoom in, zoom out, and also the imaging part of it is a challenge too. No, it's really a functional device. Yeah.
Absolutely. Okay. Well, we appreciate it so much.
Yeah.